Welcome to the topic, drugs for fungal, viral, and parasitic diseases. So fungal infections, they are actually classified as the superficial or the systemic infections. So fungal infections includes the fungus organisms that are much more complex than the bacteria. Human body remarkably resistant to that, acquired through the inhalation or the handling contaminated soil. And the superficial mycosis is the name given to which affects the scalp, skin, nails, and the mucous membranes. Systemic mycosis, if it's inside the body, it affects the internal organs. So superficial, just outside the skin, and systemic is inside the skin. Then we have some fungal pathogens. Like if it's a systemic pathogen, then the disease and the primary organ system will include, number one is the Aspergillus fumigatus and others, like aspergillosis, opportunistic disease, and it most commonly affects the lungs but can spread to the other organs. So we should know the names of these fungus so that we can give the drugs that which drug is required for which fungal treatment. Blastomyces dermatitis, it's blastomycosis. It causes blastomycosis, which begins in the lungs and spreads to the other organs. Candida albicans and others, it causes candidiasis. It's a most common opportunistic fungal infection, and it may occur in the mucous membranes and nearly any organ of the body. Coccidioides immitis, coccidiomycosis, it begins in the lungs and spreads to the skin and other organs. Cryptococcus neoformans. So cryptococcosis, opportunistic, it begins in the lungs but is the most common cause of meningitis, infection of the brain membranes in patients with the AIDS especially. Histoplasma capsulatum, histoplasmosis. It begins in the lungs and again spread to the other organs. Then is the pneumocystitis carinii, pneumocystitis pneumonia, opportunistic. It is primarily causes the pneumonia but can spread to the other organs as well. So if we talk about the superficial infection, which is outside the body, outside the skin, Candida albicans can also be outside. It is called as candidiasis. It affects the skin, nails, oral cavity, thrush, or vagina. Then we have the epidermophyton flocosum. It causes athlete's foot, tinea pedis, jock itch, tinea curitis, and other skin disorders. Then we have microsporum species, ringworm of the scalp, which is tinea capitis, Sporothrix schenki, sporotrichosis, it affects primarily the skin and the superficial lymph nodes. Trichophyton species, it affects the scalp, skin, and the nails. Now, these systemic antifungal drugs that we are using for these fungal infections, they are used for serious infections only of the internal organs. So these antifungal drugs, they are the medicines deployed in the treatment of mycosis. The fungal infections of the skin are, as of 2010, if we see, the fourth most common disease in the world, afflicting up to 1 billion people. So these are the names of the drugs, and we remember with these mnemonics: imidazoles, Comet K, C, clotrimazole, oxyconazole, miconazole, iconazole, tioconazole, ketoconazole. Then is triazoles, fitwip. So we remember with this fitwip, F for fluconazole, I, itraconazole, terconazole, voriconazole, isavuconazole, posaconazole. Then these are the azole antifungals, and how they work, they inhibit the lenosterol 14-alpha demethylase, which is an enzyme which is required to convert the lenosterol into the ergosterol. So it's going to inhibit that enzyme. Then another branch we use is the griseofulvin, which inhibits the mitosis in dermatophytes. It is ineffective topically. Then we have flucytosine. This is the name of a drug, which is a pyrimidine analog, which is converted into 5-fluorouracil by the fungal enzyme cytosine deaminase, and it is active against the yeast infections. Then we have polyenes, which can be remembered by NAN, natamycin, and through amphotericin B and nystatin. Then we have some echinocandins, which we can remember with the MAC, micafungin, anidulafungin, caspofungin, and they inhibit the cell wall synthesis by targeting the glutens by inhibiting the L1,3-beta-glucan synthase. Then we have allylamines, A-anti-ant, amorolfin, naftifin, terbinafine. So it inhibits the squalene epoxidase. Then we talk further about the systemic infections. They require the intensive pharmacotherapy for extended periods. Amphotericin B and the fluconazole that we read, they are the most frequently prescribed drugs for systemic infections, but also they include the adverse effects like nephrotoxicity, and they decrease the effectiveness of the oral contraceptives if you're taking along with. Then the superficial infections, they are of the skin, nails, and the mucous membrane. They are effectively treated with the topical and the oral antifungal drugs. These superficial infections, the superficial mycosis, which is called as of the hair, skin, nails, and mucous membranes, they are very common, but through rarely serious. So antifungals administered topically, they are safer than systemic medications. Only a small amount are absorbed into the circulation. Then comes about the viruses. Everybody knows viruses are the infectious agents that require a host to replicate. Itself, they are not alive, but when they are inside the host, then they are alive. This is their structure that they look like. They have the outside, the lipid envelope. They have the proteins in the inside. Protease, peptides, and host proteins are going inside. Then they have a capsid wall. Inside the capsid, there is an enzyme, which is called as reverse transcriptase. Integrase is an enzyme. Then they have a nucleocapsid, which is protecting the nucleus. We have different kind of a protein, P17 matrix protein outside the covering. Other than inside is the RNA genome, and we have transmembrane glycoproteins and the docking glycoproteins. This is actually a common structure of the virus. So the virus is a non-living agent that infect the bacteria, plants, and animals. So it is itself non-living, but when it enters into any host, then it becomes the living. It infects a host known as intracellular parasite, and the viruses usually only affect one species. Many are self-limiting, like common cold. Therapy challenging due to the rapid mutations of the viruses. That's what we are going through with the COVID. Now, there was one antiretroviral therapy for the HIV infection in 1990s that we used up to 20 pills daily, taken at different intervals throughout the day. But today, now with advancement, as little as 1 pill per day, it's delivering the multiple drugs. So we have advanced our antiretroviral therapy for that. But these do not cure the human immunodeficiency virus, acquired immunodeficiency syndromes, HIV or AIDS, but they do help many patients live longer lives. So pharmacotherapy of the HIV and AIDS, they reduce the HIV-related morbidity and prolong the survival. They improve the quality of life. They restore and preserve the natural functions of the immune system. They suppress the viral load to the extent possible, and they prevent the transmission from the mother to child in HIV-infected pregnant patients. So this is nothing but the pharmacotherapy of the HIV/AIDS. They are showing us, number 1 is the entry inhibitors. Number 2, we have some reverse transcriptase inhibitors, NNRTIs and NRTIs, which are going to stop the conversion of the viral RNA to viral DNA. If the viral DNA is formed, then we do not want that viral DNA to integrate. So we have a drug which is called as integrase inhibitors. If that is done, we don't want that viral mRNA to go finally make into the viral protein. So that is the protease inhibitors. So these are the 4 different kinds of the inhibitors or the drugs that we use for as an antiviral treatment. So antiretroviral drug classification includes the nucleoside and nucleotide reverse transcript inhibitor, NRTIs and NNRTIs. NRTIs, they inhibit the action of the reverse transcriptase and the viral enzyme that converts the viral RNA into DNA. We just saw in the picture, they are going to stop here. So viral RNA here, we can see in this one, the reverse transcriptase inhibitors. They're going to stop the viral RNA to get converted into the viral DNA. Then these antiretroviral drugs, they can also work like as a non-nucleoside reverse transcript inhibitors, which binds directly to the reverse transcriptase molecule and inhibits its ability to build the viral DNA. And we also have some protease inhibitors that we can see over here. It blocks the final assembly of the HIV particles. Some antiretroviral drug classification includes the enfermitide, reltegravir, and these are the miscellaneous agents. These are the newer drugs which are being developed as the scientists discover the more about the HIV replication cycle. So this enfuvirtide fusion, it blocks the fusion of the HIV to the CD4 receptor on the lymphocyte, and the reltegravir, that is called as the icentress, it prevents the HIV from inserting its genes into the uninfected DNA. So these antiviral drugs are available to treat the herpes simplex virus, influenza, and the hepatitis infections as well. So herpes family virus is the HSV type 1, which primarily causes the infections of the eye, mouth, and lips, although the incidence of the genital infections is increasing in it. Then we have HSV type 2. It causes the genital infections, and then we have the cytomegalovirus CMV, which affects the multiple body systems and usually in the immunocompromised patients. So other than that, we have varicella zoster virus, which includes the shingles, which is zoster, and chickenpox, which is varicella. We have Epstein-Barr virus, which includes the mononucleosis and Burkitt's lymphoma, a form of cancer. Then influenza virus, it's a viral infection which is characterized by the acute symptoms of the sore throat, sneezing, coughing, fever, and chills. It spreads via airborne droplets, and the treatment includes the annual vaccination, and the antivirals also supports the vaccination. In hepatitis B, which is transmitted through the exposure of contaminated blood or the body fluids, the treatment focuses on the symptoms. 90% of the infections resolve completely and will not lead to the chronic disease. The final stage of infection is the hepatic cirrhosis, and the best treatment is just the vaccination is the only treatment for the hepatitis B. If we have an active chronic hepatitis, so these are the drugs that we can use: interferon alpha B2, then lamivudine, and the adifovir. So the treatment includes these drugs: the interferon alpha, which is the natural protein that suppresses the viral replication and enhance the body defenses. Then we have lamivudine. It resembles a building block for DNA. It inhibits the viral DNA synthesis. And then we have the adifovir. It blocks the viral CAN synthesis, and primarily when resistant to the lamivudine. Then comes to the infections, which is caused by the helminths and the protozoans, causes the significant disease worldwide. Other pathogens includes the protozoans. These are the single-celled organisms which causes the malaria. The multicellular organisms like helminths, they are the mites, ticks, and the worms. And although many of these diseases are rare in the United States and Canada, travelers to Africa, Asia, and South America may acquire them overseas and return home with the infection. So the key drugs for the fungal, viral, and parasitic diseases: for anthelmintics, we use the mebendazole, praziquantel, pyrantel. Antifungals, we described before: amphotericin B, anidulafungin, caspofungin, cyclopirox, griseofulvin, micafungin, nystatin, tolnaftate, and decyclinic acid. For antifungal topicals is terbinafine. Antimalarials, atovaquone or the progonal, chloroquine, hydroxychloroquine, pyrimethamine. Antiprotozoans or non-malarial drugs are the doxycycline, metronidazole, paromomycin. Then antiretroviral drugs miscellaneous is the enfuvirtide. Antiretroviral drugs, which is non-nucleoside reverse transcript inhibitor, is the delavirdin, efavirenz, etravirine, nevirapine, rilpivirine. Then antiretroviral drugs, nucleosides and nucleotides reverse transcript inhibitors: abacavir, didanusin, emtricitabine, lamivudine, stavudine, tenofovir, and zidovudine. Then we have antiretroviral drug protease inhibitors. It's the atazanavir, darunavir, fosamprenavir, indinavir, lopinavir, ritonavir, nalfinavir, ritonavir, saquinavir, tipranavir. Antiviral drugs for the herpes infections is acyclovir. Antiviral drugs for the influenza, it's amantadine, oseltamivir, and zanamivir. Antiviral drugs for the herpes infections: cidofovir, docosanol, famciclovir, foscarnet. Ganciclovir, penciclovir, trifluridine, valacyclovir. If we have azole antifungals: butoconazole, cotrimazole, iconazole, fluconazole, itraconazole, ketoconazole, miconazole, oxyconazole, posaconazole, turconazole, tioconazole, and voriconazole. CCR5 receptor inhibitors, which is a newer drug usually reserved for the advanced HIV infections, is the maraviroc. Integrase inhibitors, the newer drug usually reserved for the advanced HIV infection is the raltegravir. So in this, we studied about the fungal infections. They are superficial or systemic. The systemic drugs are always used for these infections involving internal organs. Topical or other medications can treat the superficial infections, and no cure for the HIV and AIDS, but antiretroviral drugs prolong the life. Antiviral drugs and the vaccinations are available to treat many infections. Thanks for watching.